Hi everyone, welcome back to my channel. Today's video is all about an important topic for new moms who have delivered via C-section. When can you get pregnant again after a C-section delivery? One of the biggest questions on my mind has been about if and when I'll be able to have another baby after this C-section experience. I've been doing a lot of research and talking to my doctor, so I wanted to share everything I've learned with you all today. Whether you're a current or soon-to-be mom, here's what you need to know about getting pregnant again after having a C-section. The waiting period, so the main recommendation I've heard from multiple doctors is to wait at least 24 months or 1.52 years before getting pregnant again after a C-section delivery. I know, that seems like an eternity, especially if you're hoping to have your kids closer together. But believe me, there's a really good reason for waiting this long. The biggest risk of getting pregnant too soon after a C-section is something called uterine rupture. This is where the previous C-section scar on your uterus reopens or tears during uterine contractions and labor. As you can probably imagine, this is extremely dangerous for both mom and baby, since it can cause severe bleeding and other life-threatening complications. By waiting at least 24 months before your next pregnancy, it allows your uterus the proper amount of time to fully heal, and that C-section scar to regain strength and thickness. This waiting period dramatically lowers your risk of uterine rupture or other complications. The types of C-sections. Now, it's important to note that the type of C-section you had can impact how long you may need to wait before trying to get pregnant again. There are basically two types of C-sections, an unplanned or emergency C-section. This is when you go into labor naturally but then need an urgent C-section during labor, often due to fetal distress, lack of progress after many hours, or another complication. A planned or scheduled C-section, this is when you have your C-section scheduled ahead of time, often due to the baby's positioning, placenta previa, or if you previously had a C-section and are not eligible for a VBAC or vaginal birth after cesarean. With a planned C-section, everything is calm and controlled. If you had an unplanned emergency C-section like I did, where your body went through labor and active contractions beforehand, many doctors actually recommend waiting closer to 2 years before your next pregnancy. This is because your uterus endured a lot more stress and strain from those intense contractions before the C-section. With a planned C-section, the recovery may be a bit smoother since the surgery was scheduled and your uterus wasn't contracting beforehand. In that case, you might only need to wait closer to 18 months instead of 2 full years. But again, every woman is different, so definitely discuss the ideal waiting period with your OB based on your individual C-section circumstances. Risks of getting pregnant too soon. So what if you accidentally or intentionally get pregnant again before that 18 to 24 month waiting period after your C-section? Well, as I mentioned, uterine rupture during childbirth is probably the biggest risk factor. If the C-section scar hasn't fully healed, the intense uterine contractions and pressure from this subsequent pregnancy and delivery could potentially cause it to reopen or tear. This rupture would likely require an immediate emergency surgery to get the baby out and stop any severe bleeding. Beyond that, getting pregnant too soon after a C-section also increases your risk of placental issues like placenta previa or placental abruption, heavy postpartum bleeding due to a poorly healed uterine lining preterm birth, or other complications for the new baby. So to sum it up, you really don't want to mess around with this type of thing. Giving your body that full recommended waiting period of 24 months is so crucial, even if it feels like a long time. Getting approved for a VBAC, this next part, is something I've been grappling with a lot lately, which is the question of whether or not I should attempt a VBAC, or vaginal birth after cesarean, for a future pregnancy. For many women who have had a previous C-section, attempting to deliver vaginally again is often the preferred route to avoid having multiple C-section surgeries. However, you'll need to get approved for and clear certain requirements in order to even be a VBAC candidate. Some of the main requirements are having just one previous low transverse C-section with no other uterine scars, not having any other complicating factors like placenta previa, going into labor spontaneously on your own, having your doctor's full approval based on many other factors. For most OBs, having that lengthy 24 month gap between your C-section and your next pregnancy is one of the top requirements for even being considered for VBAC. They want to make absolutely certain that your uterine scar is healed before you experience the intense contractions of labor again. Of course, even if you do get approved for VBS, you still run the risk during labor of needing another emergency C-section for things like fetal distress or your cervix not dilating enough. And sometimes during that surgery, they might discover that your previous C-section scar has started to rupture, which is so scary. So those are some of the big things to consider when it comes to VBAC versus another planned C-section. For me personally, I'll be talking it over with my doctor, more in depth as the time gets closer for having another baby. I'll do whatever is safest for me and baby number 2. C-section recovery tips now before I wrap this video up. I wanted to share a few tips on C-section recovery that have really helped me personally over these past few weeks. Taking good care of yourself during this recovery period is so important, both physically and mentally, emotionally. Listen to your body and rest as much as possible, especially for those first 2 weeks. Don't try to overdo it. Your body has been through major trauma. Stay on top of your pain medication and use supportive belly bands/wraps around your incision to ease discomfort and support those weakened ab muscles. Do light but regular movement like short walks to encourage healing and prevent constipation or sluggishness. But don't lift anything heavier than your baby. Prepare for potential breastfeeding struggles, given the pull that nursing puts on your abdomen post-surgery. Have support people and systems in place. Don't be afraid to ask for help, whether that's with household chores, older kids, or even just emotional support from friends and family. This recovery isn't easy. And lastly, be patient with yourself and don't beat yourself up if you're feeling disappointed, sad, or even traumatized from your birth experience. Having a planned birth take such an extreme turn is incredibly difficult, both physically and mentally. Your feelings are so valid, but just know that things will get easier with time. Celebrate your strength as a mother, because you are incredible. In conclusion, if you've had a C-section and want to get pregnant again someday, be prepared that most doctors recommend waiting at least 18-24 months, or about 2 years before trying for your next baby. This extended waiting period allows your body the proper time to fully heal and recover, and dramatically lowers your risk of uterine rupture or other serious complications during your next pregnancy and delivery. I know 2 years can seem like an eternity, especially if you had your heart set on having kids closer together, but keep reminding yourself, this is for your health and safety, as well as that of your future baby. Listen to your doctor's advice, take care of yourself during the postpartum recovery period, and don't feel rushed about expanding your family again right away. We've got this, mamas. Getting through that C-section delivery makes us incredibly strong, and following the waiting period guidelines ensures our journey to having more children, whenever that time comes, is as healthy and safe as possible. If you have any other questions, definitely leave them in the comments section below. Take a look at this video to get more tips on healthy wellness. Subscribe now to stay connected and continue your exploration of the incredible selection of a variety of videos on our channel. Until next time, may your hearts be filled with love. Thanks for watching, and I'll see you all next time.